From body odor, sweating, and even discoloration, underarms can be a real challenge. But don't worry, you're not alone. In this video, we're going to tackle everything there is to know about underarms, from keeping it fresh to getting rid of hyperpigmentation. I'm Dr. Brown. I'm a board-certified dermatologist. I have been helping patients improve their confidence and clear their skin for over a decade, and I can help you too. By the end of this video, I hope to help you figure out how to minimize the body odor, how to minimize the sweat, and also how to help hyperpigmentation under your arms. This is a very common question I get in my clinic all the time. First of all, why do we sweat? Sweat is body's way of cooling off. So things that you do when you're active, your body gets really heated and it produces sweat with the intention to cool off. Sweat is normal. Sweat in itself actually does not smell bad. When the sweat comes in contact with bacteria that's normally found on your skin, it produces odor. Most of us don't like this odor. Couple ways to tackle it. One, you can minimize the amount of sweat. And two, you can minimize the amount of bacteria that you have on your skin. Some of you may have excessive sweating due to underlying medical conditions. If you have hypertension, if you have diabetes, menopause, pregnancies. So if you are excessively sweating, don't go treating your sweat without first consulting your physician to make sure that you really do have what's called primary focal hyperhidrosis. Primary focal hyperhidrosis is a condition where you sweat on certain body parts without no known cause. It means there's no underlying condition that needs to be treated. We often see this under the arms, hands, feet, sometimes in the scalp even. Now, the most common way to treat this is with antiperspirant, and I often hear patients say antiperspirant and deodorant interchangeably as if they're the same thing. They're not. Deodorant has purely just smell in it. It is designed to mask whatever smell is already in there. It does not stop you from sweating. Antiperspirants have active ingredients in them that will prevent the sweating. How can you tell the difference between an antiperspirant and deodorant? Read the label and read the active ingredient. While deodorants typically just have a smell to them, they have a fragrance added. Antiperspirants will have fragrance, but they'll also have the active ingredient, typically an aluminum-based compound, that will physically clog the sweat ducts, typically while you're asleep, most effectively while you're asleep, and prevent you from sweating. That brings me to the point that antiperspirant is most effective when applied at bedtime. The active ingredient in antiperspirant works by physically clogging the sweat glands, therefore preventing sweating, and we tend to sweat not in the same areas while we sleep. Now, the most common question I get when I say this is, what if I shower in the morning? Okay, I shower at night. After I shower, apply my antiperspirant on. If you're somebody who likes to shower in the morning, I would still apply it at bedtime and then probably double up in the morning, or try and not apply it in the morning at all. And then if it's not working, then apply it in the morning in addition to night. Now, let's say you're already using antiperspirant and your sweating is minimized, but you still sweat some and there's body odor. Here's some other active ingredients that you can look for over the counter to help minimize the amount of bacteria. Number one active ingredient is benzoyl peroxide. This is going to be found in the acne cleansers. So go to your local drugstore, go to the acne aisle, pick up a cleanser with benzoyl peroxide. When it comes to underarms, 10% might work better, but it's also stronger, so it's more likely to cause irritation. You can certainly start with 4% or 5% benzoyl peroxide active ingredient in your cleanser if you're somebody with sensitive skin. To use benzoyl peroxide cleanser to help minimize sweat, you're going to throw the cleanser in the shower, apply it under your arms, leave it on for a minute or so, and rinse off. Make sure you rinse it off completely. Benzoyl peroxide can and will stain your towels or whatever you step on when you get out of the shower. Now, this isn't something that you're going to use once and your bacteria is going to be eliminated. The same way your antiperspirant is not going to be used once and you're not going to sweat. You're going to have to repeat this daily because the bacteria that's found in our skin is going to spread back into the underarm, and you're going to need to do it every time you shower. If your skin is very sensitive or you don't want to risk bleaching anything, another product over the counter is called Hibiclens. We use this in surgeries to help minimize the amount of bacteria. This is amazing. Neck down. You don't want to use it on your face because it can be toxic to your face and your ears. But you can use a neck down in your armpits, in your groin, if you get butt acne. Keep it in the shower and use it about every other day. You can use it daily, but it can be drying. The advantage to Hibiclens is that it's not going to bleach anything. Now, another active ingredient that you may have seen on TikTok that has gone viral is using glycolic acid to help minimize the amount of bacteria. Now, this isn't just the glycolic acid. This can also be mandelic acid, but the glycolic acid is the one that's gained popularity for the most part. Glycolic acid works by regulating the pH of your skin, so bacteria that's typically found on there can no longer live in that environment. Just like your benzoyl peroxide and your Hibiclens and your antiperspirant, this is something you're going to need to do consistently to get maximum benefit. To use glycolic acid on your skin to help minimize the body odor, I recommend applying it to a cotton round and wiping under your arms. I recommend testing an area prior to using it under your arms because the underarm skin is very delicate and sensitive, and glycolic acid can be irritating to some skin types. So if you're trying to minimize the sweat, antiperspirants over the counter, they come in stick, spray, even powder now. If you don't want anything with scent, certain dry brand has just a straight up unscented antiperspirant. If you don't want aluminum, natural deodorants or plain deodorants without antiperspirant are fine, but you're still gonna sweat. And when you produce the sweat, you're gonna produce the odor because of the bacteria. And to recap, some ways to minimize the bacteria is benzoyl peroxide cleanser, Hibiclens wash, or glycolic acid. Now that we've discussed how to minimize the body odor and minimize the sweat, let's talk about hyperpigmentation under your arms. What are some of the reasons your underarms are hyperpigmented, and what are the things that you can do to help minimize or correct some of the hyperpigmentation? Some of the reasons that might contribute to hyperpigmentation under your arms are things like acanthosis nigricans. This is a condition that is more common in diabetic patients. It could be irritation from chemicals that you're using under your arms, such as deodorants, or irritation from shaving. If you're experiencing what you think is an allergic reaction to a deodorant or an antiperspirant, stop the use immediately. You're more likely to be allergic to the actual perfume or scent in the deodorant/antiperspirant than you are to the actual antiperspirant active ingredient itself. So I typically recommend using something like Dove for sensitive skin antiperspirant at bedtime. Or if your underarms are really irritated, when patients come in with contact dermatitis under their arms, I will prescribe a steroid cream, and you can use hydrocortisone over the counter twice a day for 1 to 2 weeks, but you need to stop your antiperspirant and or deodorant for the entire duration of the treatment, or else the rash is going to keep coming back. Once you've treated your underarms, pick an antiperspirant that has no perfume to it, or if you don't want an antiperspirant, pick a natural deodorant that has no scent to it. The scent is more likely to cause the irritation than the antiperspirant active ingredient itself. If you're developing irritation from shaving, I hate to say this, but really, laser hair removal is the most effective thing at treating that. I can't comfortably recommend anything over the counter that's going to help with that. Yes, you can use shaving creams. Aveeno's excellent one. Make sure you switch out the razors, and those things will help and shouldn't cause irritation if you're doing it properly. Proper shaving under the arms means you've been in the shower for 5 to 10 minutes where the hair has softened. You have used body wash to wash any residue under the arms. You have a fresh razor, and you have a good shaving cream like Aveeno. If you're doing all those things and you're still developing irritation under your arms from shaving, then laser hair removal. Now, if your hyperpigmentation under the arms is from acanthosis nigricans, but you might not know that this is what it's from. For example, if you have hyperpigmentation under your arms, don't just go applying glycolic acid or bleaching agents to lighten it. You need to understand why you have hyperpigmentation. I recommend seeing a dermatologist to determine the cause of hyperpigmentation, then you know how to treat it. For example, if your hyperpigmentation is from allergy to deodorant, you're going to discontinue deodorant and use a steroid cream until it goes away and replace it with a different deodorant. If your hyperpigmentation is from shaving, you're going to minimize the shaving while you treat it and then reintroduce proper shaving technique and proper shaving cream and fresh razor or laser hair removal, whichever is more appropriate for you. But if your hyperpigmentation is from neither of those two and it's from either friction or acanthosis nigricans, you might have diabetes. It's important to see a family physician and be checked prior to treatment. Hyperpigmentation under the arms can also be caused by friction and overuse of chemicals. So if you go applying glycolic acid to minimize body odor and then suddenly you develop hyperpigmentation under your arms, you've overdone it. Anytime you apply a chemical to the skin that skin doesn't like, it will cause irritation and itch, and when you scratch it, that inflamed red skin is going to turn brown, aka hyperpigmented, and now we have a different problem on our hands. So making sure that you always test all these chemicals prior to applying them to your underarms is extremely important. The way I recommend testing something like this, like glycolic acid, is applying a small amount on your arm and letting it sit for a day or two before washing it off completely. If you develop no irritation, you're probably fine to use it under your arms. But if you develop even the slightest itch, odds are your underarms are going to itch significantly, and then you're going to need cortisone cream, and then you'll develop hyperpigmentation. So please be careful prior to applying glycolic acid under your arms. Let me assure you, body odor and hyperpigmentation are very, very common. I see it in my clinic all the time. So if this is something that you're experiencing, you're not alone. I hope these tips helped you and you can help manage and treat some of those, but please make sure you see a physician if this is not helping, and test all chemicals prior to applying under your arms, because that skin is delicate, is sensitive, and when you put your arm down, there's skin-on-skin contact, which further increases potency of that chemical. If you found this video helpful, make sure you give it a thumbs up and subscribe to my channel. And also check out short tips on Instagram and TikTok at Dr. Aleksandra Brown. That's Aleks, no X. Let me know below if you have any questions about this topic or if you have other topics you'd like me to discuss. I'll catch you next time.